Well, good afternoon or good evening, everyone. My name is Jonathan Jones. I'll be your host and moderator for the afternoon. You've been invited to our weekly conference call discussion, where we discuss various topics. The objective here is to pass on uh, clinically validated information so that you can use knowledge and take this information into consideration as you're making decisions about your health and your well-being. I am not a medical doctor, don't ascribe to be one. We do have a special guest with us today who is a doctor, PhD, and I'll introduce him in just a moment. But we strongly recommend that you seek the competent medical advice of professionals that you trust when it comes to making a decision. The information that's being provided here today has been carefully researched. So you won't be hearing anything new or earth-shattering, but you will hear information that's part of public knowledge and public information. The source of any information, you're more than welcome to contact me, and I'll be happy to share with you the sources of anything that I have. My phone number, 754-300-8909, and my email address is jonathan@hcsaaa.com. You're more than welcome to send me notice. Don't try to call, though. That's a waste of time. You can use that phone number for text, 754-300-8909. So that having been said, I'd like to introduce our special guest, and some of you have met Dr. Prasad before. He's been on the program with us in the past. This is Dr. Kedar Prasad. Dr. Prasad is the Chief Science Officer for the company Engage Global. Engage Global is the supplier and manufacturer of one of the main products that we discuss here on this program many times. But just to give you an idea of who Dr. Prasad is, in case you don't know, sometimes they say if you don't know, you better ask somebody. Well, I'm the one you're going to ask about it, because Dr. Prasad has been published more than 250 times in peer-reviewed medical publications. He's also authored more than 30 books on the subject of micronutrition. Dr. Prasad's background is quite extensive. Here's the one that should be always mentioned on the top of the list. Dr. Prasad was, besides being the world's first radiation biologist PhD, he decided to focus on and become an expert in radiation biology. Wrap your mind around that. But he was on the nominating committee, Nobel Peace Prize nominating committee. He was the gentleman who nominated Dr. Linus Pauling for the Nobel Peace Prize. So please welcome Dr. Kedar Prasad to our discussion. Dr. Prasad, thank you very much for joining us.
Thank you, Jonathan.
We're always excited to have you here with us. I want to just show one of the publications, one of the books that you've written, because I told everybody that I was going to be talking about diabetes today. And lo and behold, we have an actual expert on diabetes that's here on the program, the man who's written a book on the very subject that I told them all that we were going to be talking about. So I'm trying to bring the book up. My computer always likes to act up whenever there's company around. Okay, here it is. So this is one of many publications that Dr. Prasad has written. So Fight Diabetes with Vitamins and Antioxidants. I got a notice about 2 weeks ago about a client that was interested in anything that you did, Dr. Prasad, any supplement connected to you. And when they found out that you were behind Micro Daily, I forget the country, I think it's Thailand or maybe Indonesia, wherever it is, they went to the library and checked out every book that you wrote. And they read everything I said. Now listen, this is not sitting down and reading Alice in Wonderland or something, or The Lord of the Rings by J.R. Tolkien. This is real sciencey and technical information. The response I got was they're loving the books. So they're thrilled that you did what you did, Dr. Prasad, in writing those books. So tell me, Dr. Prasad, a little bit of the genesis of of your connection with the product Micro Daily, and maybe just lay the foundation for us in its connection with diabetes.
Yeah, connection with Micro Daily is a long story, but it took 6 years to develop it. And it was supported by the Department of Defense laboratories and our laboratories together. And we got also funding for $12.5 million for testing. And I must have given at least 17 lectures to various the Department of Defense scientists from the Air Force, from Navy, from Marine Corps, and so on. But once they said that, yeah, you have a scientific rationale for the vitamin, but you have to be tested. And then we said, well, we don't have money to test it. He said, go to the Congress to get some money. And that's what we did. And we tried in a 2 clinical study at least, more than that. I think it is a 4 or 5 clinical studies. And first was on the whether the Marine who are in training suffer any oxidative stress. And we showed indeed they suffer oxidative stress. And when we gave our formula, which at that time called micronutrient, military micronutrient formulation, now we call it Micro Daily. So when they were on Micro Daily, the increase in oxidative stress was prevented. So that was one very interesting study. The second study was on veterans returning from war in Iraq and Afghanistan, and they had a traumatic brain injury showing these symptoms of dizziness and balancing problem. And so Dr. Michael Hoffer, who was the captain at the time in San Diego Medical Center, where all the veterans go for treatment. And so he divided these patients in 2 groups. One group got a standard therapy, another group got a standard therapy plus the Micro Daily. And in 12 weeks, the study was only for 12 weeks. And after the end of the 12 weeks, they found that the combination group who received both a standard therapy plus Micro Daily did much better in improving dizziness and balancing problem than the standard therapy alone. So that was a very exciting experiment, only for 12 weeks. We also ran experiment in hearing disorder like tinnitus. And there also we found that the Micro Daily can help in improving the symptoms of tinnitus. We also did a study on do I do all these studies?
Well, that's exactly what I was about to ask you. You just mentioned the one on tinnitus.
Okay. Yeah, tinnitus is there are 40 million Americans who have this tinnitus problem. Not only you get the people who are returning veterans from war zone, almost all of them have tinnitus, but also people who are musicians, they get tinnitus. And people who hear large music, large sound,
right,
could get a tinnitus. So it is, as I said, it is, statistics says that 40 million Americans, and sometimes at old age, you can develop tinnitus. Tinnitus, they call it, or tinnitus, whatever it may be. But this is one form of hearing disorders. And so this was a study was done in Nashville, Tennessee, by a private practicing audiologist. And she recruited 70 patients. And again, she followed up for 12 weeks. And they found that their symptoms was markedly improved by giving just Micro Daily alone, nothing else, no other treatment. And so there was another very good study we found in human. We also found that Micro Daily is also very useful in preventing the heart disease, because, and this study was done when I was in Denver, University of Colorado Medical School, And we collaborated with a fellow named Jeffrey Boone, who was the cardiologist for Bronco, NFL player. And firefighter in Denver or any place has a very high risk of developing heart disease. So he recruited any person who was at 25 to 35 years of age, and his control was that people who were taking the statin drug, and so he put just on a micro daily alone. He called by different name at the time, and so then a study was for 6 months evaluated and 1 year. After 1 year, they found that the improvement in lipid profile, like cholesterol, LDL, HDL cholesterol high, LDL low, total cholesterol was low. So it was as good as any statin drug. So he was telling me that this could be a poor man's Lipitor because it is very cheap. But an additional thing that micro daily did that no other heart medication has done thus far, that as you grow older, your carotid artery, which is in the neck, they get thickened. And when they get too much thickened, the blood flow to your brain gets reduced. Then you can have a problem of dementia and all kind of stuff. But what he did, that the statin group continued to slightly increase in the thickness of the carotid artery wall. They call it IMT. But with micro daily, it totally completely prevented any rise in thickness of the carotid artery wall. So that was a very exciting study, a modification of tissue that no other medication have done thus far in my opinion.
That's amazing. That's amazing, Dr. Prasad. I had never heard that as a consequence of that study. I didn't know that.
Yeah, that was very important.
For that reason alone, seniors would want to take micro daily.
Yeah, micro daily, and as you know that as you grow older, this is normal process. You are started getting thickened, and create kind of problems. Some people got more, some less, but in micro daily, at least it can markedly reduce the rate of thickening. And so this was a very interesting experiment. And clinical study on diabetes, because in veterans, the risk of diabetes is as high as or higher as in a civilian population.
And this study was done at Walter Reed?
Walter Reed. We started it, but turned out that by the time the company that I was associate, or I formed it really, PMC, Premier Micronutrient Corporation, ran out of the money. So they sent us the blood sample to us to analyze it, and their job was clinically. But since our company went under, we could not analyze the sample. So a study was not completed. Yeah, but what we know from the preliminary study that we were talking when we started the experiment, we had a few people who are just taking it, and they show a marked improvement. And there is a scientific reason why. For example, this is well-published information, and we will see in my book too, that increased production of free radical, what we call oxidative stress, and inflammation are the major contributor of diabetic as well as diabetic-related complications, like retinopathy, nephropathy, peripheral neuropathy, and so they're all related to these two dangerous things. And micro daily, what it does, it decreases both increased oxidative stress and inflammation at the same time. And therefore, the disease does not progress, and slowly your drug requirement that you are getting on is just started reducing. And we have many customers that I have talked to who are taking these things. And they say some people had 5 different medication
Right.
to control this thing. And he said, after 1 year, he's in none. And his wife was just a small amount of insulin.
Well, pause
And
there
so-
1 second. Pause right there 1 second. I want to come back to that medication point that you're making there, Dr. Prasad, but back up a little bit because you mentioned some of the ways that diabetes manifests itself in the body. You just mentioned several of these things here.
Yeah. Actually, I didn't see this one. Food glaucoma. Yeah, cataract. This is all stroke. These are all human diseases. But
So
in all these diseases, you have to remember, in all these diseases, those 2 things are common. They're all increased oxidative stress, production of free radicals, as well as inflammation happens in all diseases that you are talking about.
So
They
the
are
person,
complication.
so this
Diabetic
person
complication.
who's dealing with this peripheral artery disease, the person who's
Yeah.
got this retinopathy, the
Yeah.
cataracts, glaucoma,
Yeah.
diabetic foot,
Yeah.
nephropathy, neuropathy, stroke, and heart attack, all connected to free radicals and inflammation.
Exactly.
So
And macro daily controls that.
now that's a huge thing right there. So we're gonna get back to that in just a minute because folks need to understand, and we've been talking about free radicals and oxidative stress here for years on our discussion, this conference call and other conference calls that we've had. But that's the connection. This is the reason why you don't want free radicals in your body or anything toxic in your body. So I mentioned even before this that these toxins can come into the body through the food that we eat. So, and I'm always encouraging everyone to choose to go with organic and non-pesticide foods if possible. So
Yeah.
are those sources of free radicals that can contribute to this problem?
Yeah, I think pesticide is bad not only for the diabetes, but it is a bad for it can increase the risk of cancer. It can increase the risk of Parkinson's disease, and so pesticide food is no good.
Right. Okay. Well, very good. So you mentioned the anecdotal situation where you had someone who was taking 5 different diabetic medicines. Why be concerned about taking the diabetes medicines? What is the problem with taking
Well, that
diabetes
was,
medicine?
I mean, that probably that individual's doctor recommended those drugs to
Right.
control because their main idea is to control glucose.
Right.
And so they use many drugs. If one doesn't work, then another they add, because the glucose level is controlled by different mechanisms.
Right.
So they want to cut off all those mechanisms. And then, of course, that induces toxicity. But despite of that, since none of those drugs addresses the issue
Right.
of oxidative stress and inflammation, these disease progress slowly, but still it progresses.
That's
and
right.
you develop all the complications that you mentioned. And therefore, it is important that while you are taking the drugs, don't stop all at the same time. You combine with the macro daily and you measure the blood level, you will see it started going down, your glucose, then your doctor will automatically start reducing it. You don't reduce yourself.
That's right. Yeah, work with the doctors. Yeah, work with the doctor.
Yeah.
So what you're saying then is microdaily, the rationale behind microdaily is getting to the root of the problem. It's much like if I'm in my house and my house is flooding because a pipe broke, I'm not really solving my problem just by pushing the water out the front door. I really got to go turn the pipe off.
Right. Exactly.
Okay,
Exactly.
so stop the oxidative stress or get that under control, which means controlling the food that I eat.
Right.
That reduces the oxidative stress.
Yeah.
And in adding microdaily, which is lots and lots of antioxidants, and it promotes my own natural antioxidant, also fighting the problem.
Right.
So these are just some of the side effects that come from some of the medications have side effects that create problems.
Yeah, exactly.
That's interesting. This was an article that was published a few years back, a couple years ago, that one diabetes drug that was recalled because of being carcinogenic. That's kind of
Yeah.
sobering.
Actually, metformin is
Metformin, yeah.
given in a pre-diabetic situation, and for a while it is okay. It was relatively non-toxic compared to some other drug, and so. But if you combine with the micro daily, and if you are in a pre-diabetic situation, you will be okay. You won't develop diabetes.
So no matter what medication the person is on, there's no contraindication with microdaily.
No.
So this diabetic person can continue to take it, and they'll find themselves, their doctor might even start reducing their medication.
Right, exactly.
That's good. Now, dexamethasone was originally being used for coronavirus. It's a form of a steroid. And they found that steroids can cause diseases like cardiovascular disease, osteoporosis, cataracts, and diabetes. Do you want to comment on steroids and a connection between diabetes?
Yeah, I don't think they recommend steroid in diabetes at all. To my
No,
knowledge.
but they use steroids for everything else, and steroids can be a cause of diabetes according to Medscape.
Yeah, no, a steroid. I mean, a steroid is a what you call powerful anti-inflammation, but it causes a lot of side effects, especially psychosis of the brain.
Oh,
and
wow.
so you don't want to use a steroid for a long time. That is short term for a few days. There is somebody has some acute problem of inflammations because of viral infection or something, that they can have it, but not for long term.
So microdaily has been pretty good with inflammation then? So a person could avoid
Microdaily is
steroids.
really good for inflammation, yes.
That's good to know. So we now know about who this guy here is.
Yeah.
This is not quite up to date though. It says you only authored 25 books. Is it really up to more like 30 books now?
Yeah, probably.
More like 30 books. So this is Dr. Prasad. So I usually just show this picture to tell everybody about this brilliant guy who came up with this micronutrient formula that helps with diabetes and other things. And this is that same list of patents that we just talked about. We mentioned the one there on diabetes. Can you tell us a little bit more then about how the antioxidants in microdaily has an impact on the oxidative stress connected to diabetes?
Yeah, I mean, oxidative is connected to any disease. Diabetes just happens to be one of them. And the way it works, that when free radicals are there, they have an unpaired electron. So what antioxidant does that it donates the electron so that free radicals are destroyed. But antioxidant also that we have, to reduce the oxidative stress, you have to do two things. You have to increase the antioxidant compounds like vitamin A, C, E that we take from the diet. You also have to increase the endogenous body-made antioxidant like coenzyme Q10, glutathione, alpha lipoic acid, and so so this is okay. So and then you also have to increase the antioxidant enzymes.
Mm-hmm.
Antioxidant enzymes is very important, and so there is a transcriptional factor, they call it NRF2. You may have heard the name NRF2.
Yes.
You have to activate them. When you activate NRF2, they also increase the transcription or the formation of not only antioxidant enzyme, but they also detoxifying enzymes. They increase it. So you can see that antioxidant not only work in reducing oxidative stress by increasing the level of antioxidant enzymes and the level of other antioxidant compound, but it also improves the detoxifying enzyme, so your body can get rid of all the bad toxic protein that has accumulated it, and so it has a multiple effects.
Wow, that's pretty impressive, Dr. Prasad. So that would explain then why we've talked about this many times, why it's important to drink water,
Yeah,
because while microdaily is doing its job, it's binding to free radicals, reducing oxidative stress, but those toxins have to have a pathway out. They've got to be helped to
exactly.
get out, and water is one of the ways to help it get out.
Yeah, only the water, and also the enzyme, they bind the toxic substance and eliminates it and
Mhm.
destroys it, and then eliminates with the water in your body. They broke up to a smaller pieces like any toxic protein or any toxic material art form. They're broken up by enzyme, digested, and then eliminated through
That's
urine.
good. That's good. So keep that in mind, folks, as you're hearing what Dr. Prasad just said. We're talking about our bodies being full of toxins, and they've got to go someplace. Now, from experience, I found that these toxins will try to go to the weakest part of your body. So if you got a breathing problem or something else, that's where the toxins are going to try to accumulate. You have to make sure that you help them get out of your body. So drinking water
Yeah,
will be very important. Some people get
Drink,
headaches. Some people
drinking
get
water is
other
extremely important. Very
Mhm.
important drinking water.
to help get them out. And I'm encouraging to a high degree now exercise, even if all you do is walk 7,000 steps a
Exercise
day.
too. Yeah,
Walk.
exercise another extremely important, and
Good.
that build up your body and produces a lot of useful or beneficial protein in your body.
Very good. So right now we're looking at a picture of the patent for your formulation, Dr. Prasad.
Yes,
And it says that it's a micronutrient formulation for the treatment of diabetes mellitus. So
right.
there you are listed as the inventor. And part of the abstract made this statement here that it's a formulation for minimizing damage to at least one cell, organ, or system within the body is a subject afflicted with diabetes mellitus. So we're really talking about the pancreas when you made that statement right there.
Yeah,
So minimizing damage to the pancreas.
yeah. Again, pancreas. If it is pancreas, diabetic mellitus. I don't think it involves pancreas, but if pancreas is damaged by some other sources,
That's right.
it could be helpful if there is some inflammation. Anytime cell injures, they produce a lot of free radicals.
That's
They
it.
produce a lot of inflammation.
That's it. Back at the time when this patent was secured, there was only 16 million Americans that were suffering from diabetes. Today, the number is more like 130 million that are
Yeah,
diabetic and
exactly.
pre-diabetic.
That was 10 years ago or more than 10 years ago.
Yeah. Yeah. Oh, 20 years. So,
Yeah, I
but
mean, especially in a Hispanic and Black population,
that's right.
diabetes is much higher than say white population.
Yeah.
And
Yes.
this could be related to the diet,
Mm-hmm.
lifestyle.
Mm-hmm.
Those two things are important.
That's right. That's right.
Lack of exercise.
Mm-hmm. All the things that we were just mentioning. So you mentioned here that there's a connection between protection of the pancreatic beta cells against free radical damage and excess oxidative stress.
Yeah,
So those beta cells is an important part of detecting sugar levels in the blood.
yeah, because now beta cell produces insulin,
That's
which
what produces the
controls the
insulin.
sugar. Yeah,
So if the immune system, if there's actually oxidative stress and free radical damage,
you protect the pancreas cell, and then you will, then it won't be, then it will be producing sufficient amount of insulin to control the glucose.
so free radicals and oxidative stress, we can't emphasize enough how bad it is to have that.
Yeah,
And in your patent, it says that the formula is good for mitigating, if not entirely eliminating, the symptoms of diabetes mellitus. That's a pretty strong statement. We love that.
Yeah, yeah.
So there's great potential that comes from taking consuming micro daily on a regular basis. So needless to say, you highly recommend it then.
Yes, definitely.
And not just for diabetic, because you've repeated it here. You've made sure that everybody needs to know that it's not just about diabetes. That's our discussion today was just about diabetes.
Diabetes, yeah.
But
But in all human diseases, if you
okay,
make a statement that increased production of free radicals or increased oxidative stress and inflammation are the major causes of this disease, nobody will argue that.
that's fantastic. And here's the interesting thing, Dr. Prasad. Those with pre-existing conditions like diabetes tend to have a higher risk of an adverse outcome from something like COVID-19 or others. So it
Yeah,
would be wise to control this.
yeah. I mean, COVID-19 again, that's a very important issue. I don't know that we want to discuss it.
No,
But
I don't want to. We're not going to go into COVID-19, but we're just talking about the benefits of dealing with diabetes, because if a person does have a run-in with COVID-19, their chances are worse.
yeah, because your immune system is down because of diabetes disease. You have increased oxidative stress and inflammation, and they will damage all parts of the body, not just insulin or pancreas, but also the other parts of the body. So your immune system is low, and therefore you are more susceptible to any, could be a viral infection, could be bacterial infection, any kind of it, could be flu, could be
Right.
shingles, any kind of viral infection.
Any kind of an issue. That's right.
Yeah.
Very good. Very good. Okay. Well, excellent. Why don't we take a couple minutes and address a few questions, because I know that the this group has been itching to ask a few questions. So, but we're gonna just remind everybody that this call is not about making health or medical recommendations. Dr. Prasad is not a medical doctor. Dr. Prasad is an expert in radiation biology and the inventor of microdailies. So we need to avoid asking medical, specific health and medical questions. We strongly recommend that you seek the competent medical advice of professionals that you trust. Speak to your primary care physician, and Dr. Prasad will not go against anything that your doctor has recommended. Okay, so as long as we just lay that ground rule there. So Joanne Gabriel has a question that she'd like to ask. Go ahead, Joanne. Don't forget to unmute yourself.
The question I need to ask, what's the difference between micronutrient versus multivitamins?
What is the difference between micronutrient and multivitamin?
Yes.
No,
Micronutrient
micronutrient is the word that, there are two types of nutrition, macro, which is like protein, carbohydrate, fat, and then micro. And micronutrient includes antioxidants or multiple vitamins. And so all the vitamins are there. We just call it micronutrient because in addition to vitamin, we also have some minerals. And therefore, we call it like we have a zinc, we have selenium. And so, so we just say it is a micronutrient because they are micronutrient. But micronutrient also includes all the vitamins or all antioxidants.
Okay, because I noticed, I was reading something with my vitamins, and I noticed they were multivitamins, but they have like the zinc, they have the minerals also in it. So I'm just trying to, is it a play with names or something, or is it the same thing? Okay, you said it is an antioxidant, and
Yeah,
you said
sometimes you will see that commercially, if you look your vitamin that you have bought it, first you see if they have an iron, copper, or manganese. That's one. And do they have if they have, that's bad. They also see if they have a heavy metal, like zirconium, molybdenum. If they have, That's not good. Also, you found out, do they have a body-made antioxidant like glutathione elevating agent, alpha lipoic acid, or coenzyme Q10? And so these are very important differences. Also, you will find out whether some of these things, for example, selenium, is it selenium oxide or it is selenomethionine? That makes it different because selenium oxide is cheap, but it is absorbed very poorly, and this is very bad. Also, you will have to find out whether the B vitamins are methylated, like vitamin B12 or folic acid. So these are the major differences are, and sometimes multiple vitamin will have they will add some herbal product. Herbal product, I avoid it for two reasons. One, we don't know whether it could be toxic or interfere with your medication that you are taking, prescription or non-prescription. And second, that none of the herbs produce unique effect that cannot be produced by the ingredient or vitamin that we have in Micro Daily. So there is no reason for adding that.
Mhm. Okay, so you would, I noticed that a lot of people label vitamins like natural vitamins, synthetic vitamins. So would this be considered something that is synthetic?
No, I mean, some vitamins are synthetic, but all the vitamins are natural sources. But see, if you take say, for example, vitamin A, and if you take just vitamin A in its natural form, but they are very unstable, and you can't make a capsule out of that. So what they do, they make a vitamin A palmitate in the laboratory. That is not synthetic. They're all natural. Same way like vitamin E. The natural form is alpha tocopherol. But if you have alpha tocopherol, they are not very stable, and they will be all destroyed. So then they will make alpha, like we have done it, alpha tocopherol succinate or alpha tocopherol acetate. And this thing is some problem here that they have made it. See, Jonathan, it says alpha tocopherol succinate in both cases. One case is acetate, another case is succinate. So I don't know. I never saw this.
Okay, so it works. So this wouldn't work with a person if they're taking medicine. They can take the micronutrient. Does it work with your, like prescription? Like a person taking blood pressure pills.
Yeah, anytime. No, if you're taking blood pressure pill, it is okay to combine with this Micro Daily.
Okay.
Very
Or
good.
any kind of medication you are taking, Micro Daily would not interfere with that.
Oh, okay. All right. That's what I needed to know, because sometimes you take a bunch of stuff and it can interfere with other medications. So a person can take this and also take their medication. That's the question. Thank you so much, Dr. Prasad.
Sure.
Thank you, Joanne, for your question. And Dr. Prasad had to prove that to the United States government, to the Internal Review Board. So that's not just an opinion. That has been proven. So, but thank you for your question, Joanne. Thank you. Joyce Stanley has a question now. Go ahead, Joyce.
Yeah, hi, Jonathan. Hi, Dr. Prasad. I find it such an honor to be able to say hi and thank you so much for this formulation.
Thank you.
It has, I've been taking it since 2017. And when I first started taking it, I'm not saying this is anything anybody is going to happen to them, but I had a problem where my heart was actually skipping. And I was in the emergency room and I was scared and I was dealing with it for a long time and it was getting progressively worse. And when I started with the Micro Daily, it stopped doing that. And I have not had a reoccurrence, only minor times throughout since 2017. So I love this. And then I started taking the eye boost because I was getting a lot of pressure behind my left eye. And my left eye has been bothering me for a couple of years. And so when I started taking the eye boost, within that week, the pressure went away. I no longer feel the eye actually in my head, where I was feeling the eye in my socket. So thank you so much. But my question is the I can't say it. Anacetylcysteine, thank you. What is that? Because someone told me today that one of their natural doctors suggested that to help them fight COVID. And I see it's in this product. What is that? How does it help?
I think it is not true that, it is true that if your immune system is good and micro daily can improve your immune system, and therefore you will be more resistant to any kind of infection. But I always say that suppose if your immune system is very good and you take a flu vaccine or any kind of vaccine, your body will produce much robust antibody, then your immune system is not good. So micro daily improves your immune system. Now you take any kind of shot, vaccine, whether it is a shingles, flu, or COVID-19, they will produce more robust antibody and provide a better protection than those who are not on micro daily, but still they will provide some protection because they will produce some antibody, but not as much antibody as if you have taken both micro daily as well as the vaccine.
So the N-acetylcysteine, the main function of N-acetylcysteine, Dr. Jimmy Gutman did a lot of research on it, is that N-acetylcysteine promotes the monoclonal expansion of not just of T cells, but produces lymphocytic glutathione.
Yeah, because N-acetylcysteine is, see, the glutathione is elevated by two bases. One is the alpha lipoic acid, because it increases the enzyme glutathione peroxidase, and then they make it. So that is enzymatic pathway. But N-acetylcysteine, when they get absorbed, they remove N-acetyl, and cysteine is used to make glutathione.
Right.
And so if you are using both alpha lipoic acid and N-acetylcysteine, you have the highest level of glutathione, and you will have a maximal benefit. But if you are just using a NAC, you will have some effect, but not the full effect.
So the two together is very important. And the importance of glutathione is the body's master antioxidant. So that works, makes all the other antioxidants work better.
That's true. Glutathione is the highest level of antioxidant in your cell and compartment than any other antioxidant.
I think that's what I was waiting to hear. I remember hearing that before. And I've researched glutathione like a couple of years back when I was into something else with hydration of the cells and how that helps to something else. But thank you so much, Dr. Prasad. Keep up the good work.
Well, that's excellent. Thank you very much, Joyce, for sharing your stories. Now, before we go to the next question, Dr. Prasad, she mentioned, and I met Joyce years ago when she first started taking Micro Daily. Could you maybe just give us a brief explanation as to why her heart issue might have improved because she added some micronutrition in her body?
I mean, as I said, that I don't know why what kind of heart condition she had, but it was if related to, let's say, for example, cholesterol level, if it was related to, thickening of the wall that we know, and if it's related to oxidative stress or inflammation. I don't know that particular heart disease, what condition she had, but I'm glad that she improved it. That shows that, antioxidants have many other functions that we know.
Right.
And it is much more complex extent than just the free radical scavenger. And so we feel that it is a must.
That's important. And I really want you just to comment on that because everybody needs to know. We use the words oxidative stress and free radical damage, and we simply assume that everybody understands that it can manifest itself in any number of ways. If you have
Exactly.
disease,
Exactly.
every single disease links back to some level of free radical damage or oxidative stress,
Yeah. Yeah.
no matter what it is.
No matter what it is.
That's important. So I hope everybody heard that loud and clear. We have another question here. Karen's PC is trying to ask a question. So Karen, I'm assuming your PC is not your last name, but go ahead, Karen.
Hi, hello, Dr. Prasad. Hi, Jonathan. How are you this afternoon?
Very good.
Good. I just, in taking the micro daily in the capsule, I know that you recommended that it's best to take it with meals, the food, or something like that. But when it comes to hydro, then it's not necessary to take it with meals, being that it's liquid. Is that correct?
Yes, because the reason is we always recommend is some kind of meat, and because some of those vitamins are fat soluble, and therefore you have taken some food, it has certain amount of fat, therefore absorption of fat soluble vitamin would be better than if you take an empty stomach.
So it's better to use food both with the capsules and with hydro.
Yeah.
Oh, okay. So take.
In case of hydro, it is absorbed quickly. And so, but still when it goes to your stomach, they have to be absorbed. And you need some fat there.
So some fat soluble, some of the components in hydro and micro
Vitamin A is fat soluble.
is fat soluble. So you need to have some food to be able to absorb it
Some
properly.
food, exactly.
Oh, okay. I didn't realize I was just drinking the hydro, like, just drinking. I don't drink and eat at the same time. So,
no.
Okay, that's good to know. Thank you.
No, if you take just hydro in empty stomach, it will be only water soluble vitamin will be absorbed. And the fat soluble might absorb a little bit because you always have little bit fat someplace, but not much.
Okay, good to know. Thank you so much.
Very good. Thank you for your question, Karen. That's wonderful. Now, Karen, no, there's one more question here before I go on to my question. CJ Williams, go ahead, CJ. Let's get your question.
Hey, Jonathan, I'm gonna let someone else ask that. Go ahead.
Ms. Mama, my question is, I was recently had a whole cardio workup, and I had they found I had AFibs. So they put me on a blood thinner, but they also put me on a medication. I think it's called Metropolar or something to slow my rate down a little bit. And I was taking the micro daily, and I kind of stopped a little bit. But would that have any effect on me taking, because I'm on these two new medications now, with me taking the micro daily?
No, if you are taking a medication like blood thinner or anything, micro daily will have no adverse effect, and so it can improve your overall health. But if you have some heart issue, it is important to follow the cardiologist's advice. But my cardiologist will say always that vitamin is okay.
Yeah, because I'm taking something called it's called Metropolar.
Any medication you take it, if you have some heart problem or any arteries problem, then they recommend blood thinner, but again, it has no interaction with micro daily.
Okay, I would just want to know, because I'm taking the micro daily now. I take 2 packs a day because I have a host of things, because I also have diabetes, type 2 diabetes, and I've been taking that to kind of help with my inflammation, and it seems to be helping.
Good.
Very good, very good. Thank you for your question and for your comment, CJ, other person in the room. That's wonderful. Appreciate that. So, Dr. Prasad, I was going to ask you, based on what Joyce said earlier, she said that she started taking the eye boost and she noticed that the inflammation in her eye seemed to improve. Now, could you maybe help us to understand why eye boost might have an effect on the eye?
For example, we have an eye boost formulation like astaxanthin, zeaxanthin, and lutein. And astaxanthin, that is not, people have tried in the past only with lutein and zeaxanthin. But added astaxanthin, as you know, eagles have all three pigment. Human have only two. And but astaxanthin accumulates in the eye almost 500 times more, and it is very powerful antioxidant and anti-inflammation. And back of your eye is highly oxygenated. And anytime you have a highly oxygenated area, the chances of producing more free radicals and therefore damage. And so, but blood pressure is, like glaucoma. My wife has a blood pressure, and not blood pressure, but pressure in the eye. And she went to the doctor, and doctor did some medications and improved some. But since she started taking this eye boost, and I take eye boost too, and so her now eye pressure is 12. Otherwise, used to be 16, 18. And so, as I said, that we exactly don't know. We know the eye pressure, some drainage problem that could be damaged by free radicals. And as long as it helps, it's okay.
That's wonderful. That's wonderful. It's exciting to hear because more and more people are
that's one of the
realizing.
major, in older people, that's one of the major problem. If your pressure increases, that can lead to a blindness.
Yes.
And therefore that it has many cases, looks like, my wife's case was a good case. Mine is always 12, 11, something like that. And so I think it is very good that it is having that kind of effect, which I would not have predicted it.
Right. No, I don't think I've ever heard you.
We don't know how all these things work in your body.
Right. I've never heard you even comment on anything like that with the eye boost. So that's nice to hear.
Yeah.
We have time for maybe one more. B has a question here.
Yes. Good afternoon, Dr. Prasad and Dr. Jonathan and Ms. Frida and everyone here. I have a question. Is someone, it's like, they're under the weather and their breathing is low and everything. And they feel like they got over the COVID, but still their oxygen levels are low. Would microdaily help out with that and dealing with their diabetes?
Can you repeat the question?
She says, what she said, Dr. Prasad, was if a person has maybe feels like they recently got over COVID, but they're still having a little trouble breathing and their oxygen levels are low and they're diabetic, would it be wise for them to continue taking microdaily?
Yeah, microdaily is always good. Yeah.
So it could be beneficial for
increase their oxygen levels.
and increase oxygen levels.
Yeah, I mean, if the symptoms improves, and then the thing is that many people who recover from COVID, and that's the reason I strongly suggest that you take microdaily and the vaccine together. That if you have a COVID and you recovered, still you have a problem of heart. It could have a lung problem, heart problem, brain problem. Right. And so at least the microdaily will help you some. But once you recover it, then it will be a good idea to consider taking ask doctor advice whether it is good for you to take a vaccine or not.
Okay.
And B, my recommendation on that, on top of that, B, is increase the amount a little bit more. So instead of 2 capsules, take 3 capsules twice a day. Okay, that's my recommendation on that.
Okay.
But we always recommend 3 capsules twice a day anyway. Oh, I mean microdaily. You are talking about not microdaily EMF. Okay.
Correct.
Yeah, take it 3. That's fine. That will be fine.
A little
you
bit
said
more,
3 capsules, 3 times
twice
a
a
day
day.
would be good?
Yeah, increase it, especially because of diabetic, all right?
Okay, thank you.
You're
That would
welcome.
be
Thank
okay.
you for your question. And
Yes.
Dr. Prasad, we're going to squeeze one more question in. Marie, Sita, is this a quick question?
I have type 2 diabetes, and I'd like to know which kind of micro daily should I take to improve my pancreas beta cells to make it stronger.
Yeah.
So
I
which
think
kind should I take?
take any of these products we have, make sure the micro daily methylated, methylated form. We have micro daily methylated form as well. And you take either that one or micro daily EMF. One is more costly than the other. And so it depends upon you. Both are good. Both will help
Okay.
you.
Because right now I'm taking the EMF.
Yeah,
So
that's perfect.
I can continue this then.
That's perfect. That's perfect. Yeah, micro daily EMF, and that will be, yeah, that's one of the best recently developed one, and which is also very good. It is a little costly, but it is good. And so keep taking it, and you will see the effects on your diet, whatever condition you have, you will see improvement.
Yeah, I was reading the chart that you showed earlier. And when I look at the type 2 diabetes, then on the side of what type of microdaily was initially, was it called MMF? This EMF is initially called MMF. That's what I saw on the chart.
Yeah, MMF was a military micronutrient formulation. That was the old name of microdaily.
Oh,
and since then we have evolved to microdaily coenzyme Q10, and now we call it. And then we have methylated form of microdaily. Then most recent one is the microdaily EMF, which was developed because of the people were concerned about additional concern in addition to other disease was EMF radiation from Wi-Fi and computer and cell phone and so on. So
television also.
Television, yeah. So to eliminate that particular thing was developed, which was also very effective in protecting against ionizing radiation. Like if you go for X-ray, chest X-ray, or any kind of X-ray, make sure you take a 2 capsule before, or 3 capsule in case of a microdaily EMF, and that has been shown clinically. As you know, Jonathan, that we did a study with our formulation of antioxidant, and that one CT scan, if you do it, it causes double DNA breaks. It is one form of DNA damage. And if not repaired, that can increase the risk of cancer. Excuse me. And so, so the patient, if the patient were given a microdaily antioxidant of microdaily, and then went through the CT scan, the reduction in a DNA damage was over 50%. So
Just one more question.
Yeah.
On glutathione, I understand that our bodies naturally build glutathione.
Correct.
Ourselves. Am I right? Okay. Yeah. Now, I am looking at the ingredients of the microdaily, but I didn't find glutathione there. If it has the highest level of antioxidant, then it should be on the microdaily, isn't it?
No, see, here is the problem. Glutathione is not absorbed from the gut. And therefore, we have given a alpha lipoic acid and N-acetylcysteine. Those two together, one alpha lipoic acid will increase glutathione by increasing the enzyme, which is important for their synthesis. And we added N-acetylcysteine, which will provide cysteine that uses to make glutathione. So combination of both will produce more glutathione in your body than your body needs it. But if you take a pure glutathione, it is not absorbed, so it is a waste of resources.
So we wouldn't put glutathione in the product, Cedar.
No,
So
not at all.
the precursors for glutathione is what's in Micro Daily. So the precursors, in other words, what will cause your body to make more glutathione, okay?
That's right, because it provides all the necessary ingredient and they are absorbed better.
Okay, so the formulation, the way I understand it, is the formulation is the one that is helping to build glutathione in our body.
Correct. Your body will make it.
This
Exactly.
formulation, the Micro Daily.
Exactly.
Correct.
Yes.
Okay,
Good questions. Thank you very much for that.
thank you.
Cedar.
Thank you very much, Dr. Prasad.
Sure.
We have to squeeze, no, thank you, Cedar. We have to squeeze one more in, Dr. Prasad. John and Ruth Lawrence, they've been around since the beginning of time in our
Okay.
relationship with Engage Global. So we have to squeeze their question in, but
Okay.
John and Ruth?
Yes. I have a lifelong friend that has diabetes. He's waiting to get a kidney transplant. So far for the last year or so, he hadn't been able to get the right path. Would it help that person if they was taking the MFS?
So here's a person,
would it help?
here's a person, Dr. Prasad, who's waiting for a kidney transplant. They've got diabetes, advanced diabetes, and they're on the list for kidney transplant. His question is, would it help them to take Micro Daily?
Sure. It's always good because in case of they have a transplant and then at that time, if it's that, it's a tough decision because at least your body would be healthier state, so you can survive the transplant,
Yeah.
But after transplant, the question is, they will give you immunosuppressive drug, like Dr. Cole had, but Dr. Cole, the doctor said that your transplant will last only 10 years, and because she was taking multiple vitamin and later on Micro Daily, it is now 21 years since, and he is still alive. So even though you are taking immunosuppressive drug and you think Micro Daily will interfere, it doesn't look like interfered with the drug in terms of rejecting it. And so even though cyclosporine is one of the drugs that generally they use in kidney transplant to prevent rejection. And so maybe after transplant is get stabilized, they can start Micro Daily without any, at least few cases that we know, does not interfere with the, in other words, you will think that it should reject it.
Yeah,
but it doesn't. As I said, that many times we don't know why. And after transplant, if you are taking immunosuppressive drug, you are susceptible to all kind of stuff. But with Micro Daily, it prevents many other kind of infection and so on. And so, but of course, you consult your doctor and whatever doctor advice, you will follow it. But in my opinion, it would not improve any chance of rejection at all, because of my colleague who is a kidney transplant patient, and he's living twice than what, and is still alive than what doctor predicted.
That's wonderful. That's wonderful. Thank you so much for that, and thank you, John, for your question. So the long and the short of it is, Micro Daily now, while they're waiting for the transplant. If they get the transplant, Micro Daily. So there's the answer to the question. So thank you. Okay, everybody.
Okay.
Dr. Prasad, we can't thank you enough for your insight and for your gift to us and to the people that we come in contact with. Your brilliance has made it possible for us to be able to share some very positive things with a lot of other people, and we appreciate that. So we appreciate you taking the time to come on to our program. So we look forward to having you on again next month. So
sure.
I'm sure that everyone will be excited to have you back again. So
I will do that.
So thank you very much again. Okay. So for the record, everybody, Okay, Dr.
Thank
Prasad.
you.
Thank
Thank
you.
you. Great.
Thank you, Dr. Prasad.
Thank
Thank
you.
you.
Thank
Thank
Dr.
you.
Prasad.
Thank
Thank you so much,
Thank you,
Dr.
Dr.
Prasad.
Prasad.
Have a great
Thank you,
day.
Dr. Prasad.
Thank you.
Yes, thank you for
Thank
being
you.
wonderful.
Dr. Prasad, thank you.
Thanks,
everybody, for coming. Thank you, Jonathan.
And
Thank you, everybody, for coming.
Thank you,
Thank
Jonathan.
you.
Thank
Much
you,
Take care.
Chief
appreciated.
Thank
Jonathan.
Thank you.
All right, we'll see you all. So listen, if you guys want to stick around for a brief business meeting, we can
Thanks,
take a
John.
couple minutes now for any who want to stay for the business meeting.
I'm not very business